Hi, Corey here with Align Therapy. I'm here with Tyrus. He volunteered to help me demonstrate how to measure rotation in the spine for those of you that have scoliosis or have kids that have scoliosis and you want to try and monitor if that's progressing or not. This is for those of you who are wondering, should I go see a pediatrician to get an x-ray? I see a rib hump that I didn't see there before. Maybe one shoulder blade is poking out. Maybe you have a little bit of muscle that's poking out on the back. Maybe you noticed it at the pool when your kids were bending over or diving. All of these things can be easily assessed at home using just one simple test. It's called the Forward Adams Bend Test. I'm going to show you how to do that. And we're also going to talk about some risks of progression that I've seen and how that can be mitigated if you get told that, oh, you don't have scoliosis, but you still have that rib hump. So, Tyrus, if you can turn this way for me. In the clinic, we have what's called a scoliometer, and you can actually buy one of these online at Amazon. I think they're $20 at the time of this video. So, not crazy expensive. You can also use the Level app on your phone. Okay. What you're going to do is have your child or have someone do this with you. You're going to ask them to bring their feet together. And then, Tyrus, I want you to bend forward. Just let your arms come forward and think about touching your forehead to your knees. And then from here, if you want to come around and look behind here, this is essentially a level that's going to give me some measurements of how far the trunk is rotating when we do this. So I'm going to start here at the top, and it's important that you hold it perpendicular to the floor since it is a level. And then you're going to start here and you're going to slowly slide this up just like that, keeping this right in between the spine. Okay. And now with Tyrus, we know that he has scoliosis, and we're going to start seeing that level go off. We'll call this a left rotation. And we're measuring about 7 degrees there of rotation. Okay. If you don't have one of these, you can take your phone and you're just essentially going to take a picture of that horizon line. Okay. And then for his back, since he can't bend in half, right? We can have him stand up. And stand up, Tyrus. And he can stay bent over like that. And you should be able to feel if there is a bump on either side of the spine. He has one right here. There's a step off. And it's visual. You can see how there's a bulging of the muscle tissue as that vertebrae is turning. And it's bringing that tissue up to the surface. Because he's strong. He has a lot of muscle there. You might also see some bulging here of these muscles if he had a curve on this side. But that's essentially what you're looking for, is asymmetry on either side of the spine, anywhere along the spine. If you notice this, then you can suspect, go ahead and stand up, Tyrus, you can suspect that you or your child might have scoliosis, and it would be good to get in to see if you can get an x-ray to determine the severity of the curve. Thanks, Tyrus. You can turn around. And you can put your shirt on if you like. So, one thing I wanted to talk about that I've seen here in the clinic every now and again is I've had patients come in and they didn't get the diagnosis of scoliosis. They had a curve that was under 10 degrees, but they still had a rib hump or a hump in the bottom of their back. And they said, should I still be concerned? Is this something that I should be addressing? My pediatrician said to wait and see. And then years later, they get another x-ray because they're having back pain. And lo and behold, over those 3 years, that curve that was under 10 degrees progressed to 30 or 40 degrees or worse. They might be looking at surgery now. that's an outcome that I think that could be really mitigated just with this simple test. You can monitor the rib hump every 6 to 12 months, and if you notice that that is increasing or changing or looking worse, or you start to see more of an imbalance when you're sitting, you start having more pain, then get in at the soonest time that you notice that, and we can hopefully mitigate that curve from worsening anymore. There's a lot of options for reducing the risk of progression of scoliosis right now. Many years ago, it used to just be, okay, we need to brace you if you have a 25-degree curve or more, and if you don't, then we just need to have you come in each year, and we'll monitor it. But not everybody goes back to those appointments, and it might get missed. Or maybe somebody doesn't go to the pediatrician, or maybe they don't check it at your school anymore. I think there's better options now that are active. We don't have to passively wait to be told, oh, you need a brace now, or oh, you need surgery now. Right now, there's great options in physical therapy to learn how to actively correct your posture specific to your curve. At our clinic, we use the Schroth method, and it works. We see good results with our patients. We see the rotation decrease. We see the curve stabilize or reduce. Sometimes it progresses, but I like to think that in the case that they didn't do anything, that curve may have gotten worse had they not tried physical therapy or tried some kind of intervention to prevent this from happening and getting worse. So if you were told that on your x-ray you didn't have scoliosis, but you're concerned about it because you see that rib hump, monitor it using the test that I just showed you every 6 months to a year. Take a picture, keep it in your log, and compare. And if you start to see that increase, get in touch with a healthcare professional so that we can intervene, so that we can mitigate this from getting any worse. If you have any other questions, you can visit our website and the links down below. We have great blogs on adults that have scoliosis, how to treat that, adolescents with scoliosis, if you have back pain. Lots of great stuff on our website. And reach out to us if you have any questions by calling at the number at our website. So, thank you.